Hi everyone, welcome to today's CHE Alaska webinar, which is titled Community Engagement for Breast Cancer Prevention. My name is Sarah. I'm the Communications Coordinator with Alaska Community Action on Toxics, or ACAT. And CHE Alaska is a program of ACAT and Collaborative for Health and the Environment, and it's also part of CHE's broader international coalition of over 5,000 individuals across the globe. And we'd love if you could also introduce yourself in the chat and let us know where you're tuning in from, or if you're with an organization. Um, and ACAT's breast cancer prevention initiatives are supported by the Alaska Run for Women, which has been funding our work for over a decade. So we're very grateful to them for their long-standing support of this important work. So yeah, the chat is enabled now, but we'll keep it off during the presentations. But if you have any questions or comments throughout the webinar, we'll have an audience Q&A at the end of our call today, and you can use the Q&A box feature at the bottom of your screen for that at any point throughout the webinar. So I'm excited to introduce our speakers today. We have Nyisha Green-Washington, who is the Senior Organizing Manager of Breast Cancer Prevention Partners, and she leads the new project called Californians Linking Action with Science for Breast Cancer Prevention, or CLASP BC. Next, we have Lianna Hartmour, who is the Program and Communications Director of Zero Breast Cancer at CHE, and she has led the programs at ZBC for 7 years before the organization became a project of CHE just last year. And then we have Dr. Samarys Seguinot Medina. She is Boricua from the archipelago of Boriquen, or Puerto Rico, and she's been ACAT's Environmental Health Director for the last 15 years, leading community-based participatory research. So thank you all so much for joining us today, and now I'll hand it over to you, Nyisha, to get us started.
Thank you so much. Let me just share my screen. Okay, does that look good? Okay, perfect. Hi, everyone. I'm Nyisha Green-Washington. I use she, they pronouns, and I am the Senior Organizing Manager for Breast Cancer Prevention Partners. And for those who don't know who we are one of the only breast cancer organizations that focuses on primary prevention. And we work on eliminating toxic chemical and environmental exposures that are linked to breast cancer risk. And we do that in 3 ways. We do policy, legislation, education, and market campaigns. So I'm going to talk a little bit about CLASP, which we've shortened down to Charting Paths to Prevention for Breast Cancer. And this was our community-based action or grant that we were funded by the Breast Cancer Research Program to bring the science to communities that are most impacted by breast cancer risk. But before I start with that, how we got the grant for Charting Paths to Prevention is through our cancer plan. We were tasked to produce our cancer plan for the state of California called Paths to Prevention. It is 300 plus pages long, but it is on our website. And it is one of our biggest campaigns and one of our most unique ones, as many cancer plans focus on things like individual tasks and individual ways to reduce your breast cancer risk or cancer risk in general. And where we took the science around primary prevention and systemic interventions, we use the social justice lens, racial and lived experience as well. And we looked at science backing primary prevention that, again, focuses on systemic interventions. We were really big on listening to the community. So we did listening sessions when we were building Paths to Prevention, looking at ways that people in most impacted communities are already doing this work and how we can support them. And so out of Paths to Prevention, we were funded to do Charting Paths to Prevention. And we came up with 23 science informed, science-backed breast cancer risk and protective factors. There's about 23 of them here. We looked at over 330 policies. We looked at a lot of research, 85 research papers, maybe even more than that. And we came up with these that had the most science behind it. So as we said, we did Charting Paths to Prevention. And this is where we linked the action to science. So we took all of that science-based evidence for interventions, mostly systemic. And we did something called group concept mapping, where we brought those about 84 interventions. They were all, again, systemic, policy, or community action based. And we asked the state of California, folks in the state of California, to take the survey and to rank those interventions based off of feasibility and importance for the community that they live in. And then after those group concept mapping surveys were administered, I believe we got over 340 people to participate. We took those results to 8 regional meetings, and then we did a training on something called CPPR, which is Community Partner Participatory Research, which I'll talk about a little bit later, which is the phase 2 of this grant, which we have applied for, and hopefully will be funded for that. So we took, for charting past prevention, we used these risk factors and protective factors, and we highlighted the top 2 risk factors, or not the top 2, but the ones that really, really laid the ground and foundational work for our work, which is race-powered inequities and social and built environment. We have a saying at BCPP, don't do anything about us without us, is kind of the feedback we've gotten from communities. There are a lot of research and work being done on communities impacted that often don't include their voices. So we were very big on making sure we went to the communities most impacted, focusing on, communities of color, low-income communities, communities that are dealing with environmental racism, so frontline communities. In addition, we took some of these chemicals and consumer products, ionizing and non-ionizing radiation, et cetera. And then we also talked about protective factors, which obviously a lot of us know: health, food and nutrition, physical activity, pregnancy, and breastfeeding. But the caveat to that is that we know a lot of people do not have access to healthy food and nutrition. So again, we focused on systemic ways. And so I connected with, food justice organizations, connecting with labor organizations to let them know that, like, the work that we're doing is connected. And seeing the connections was really exciting when I was doing these regional meetings. So the concept mapping survey, like I said, we took 330 interventions. We broke people up into stakeholders, which were community leaders, academics, policy experts, and healthcare practitioners. We use community leaders and policy experts interchangeably because we believe that those closest to the problem know the solutions. And so we believe they're policy experts. And then out of the concept mapping, like I said, I did 8 regional meetings across the state to bring those results and see what really was exciting for folks, what they wanted to work on, if they had funding around breast cancer risk and reducing their breast cancer risk. And so that was the next step. And so these are the 8 regional meetings that I did. These are the regions all over the state. We broke them up based off of, I believe, the California Error in Resource Board, but they were 8. We started off in LA. That was our first regional meeting. And I wanted to just briefly talk about how sometimes your first meeting doesn't always go off as expected. We got a lot of feedback in LA that it was too much science, too much information. It was very overwhelming. And so we went back to the drawing board for our next ones and really listened to the community feedback and dropped a lot of what we were presenting to make sure that people really understood the science behind why we are doing breast cancer risk from a primary prevention lens. So that was really eye-opening, and I always bring that up as a community organizer because we fail all the time. We always are having to scratch and redo and go back and listen to the community when we're doing something that isn't quite working. So Los Angeles was our like play regional meeting, and we really were successful after that. After we changed how we did the meeting, we shortened it. We made more time for storytelling and for the community to have time to speak about their experience around breast cancer risk. Because as we all know, so many of us are touched by breast cancer. And in California, it is the highest cancer for women in the state. And so we were really excited for the results of this. And then after we did the regional meetings, after we completed all the regional meetings, we hosted something called Community Partner Participatory Research Training, where we took community members and trained them on what this means. And the goal of community partner participatory research is to include the community that we're studying. Oftentimes when research is done, it's done without the community's input from the beginning. The research project is built and then they go out to the community. We are big on making sure the community is included in the research from the beginning, tailor the project for how they want it for their communities. And so it was really exciting to have all these different staff from different universities who came and presented, and all these different organizations who didn't think they were already doing CPPR. Most of us are, just a fancy word that they use in academic terms. But most of us who are doing community-based work are already listening, going out, doing this research. And so the goal of this was for phase 2 of class is to help some organizations, including us and other organizations, apply for phase 2, which would be to take one of these interventions and study it to see if it does actually reduce breast cancer risk. And so we applied with an amazing organization called Líderes Campesinas. I didn't include that here, but I just wanted to shout them out. And they are a farm worker organization who we will be working with to, hopefully if we get funded, to study breast cancer risk reduction tools and ways for the farm worker community, because unfortunately they're exposed to pesticides that are directly linked to breast cancer risk. I wanted to share some other examples of work we've done. We worked with an organization called ADEPSCA that has a community action network, or they call themselves Mujeres en Acción. And they are amazing. They're a group of domestic workers who are just fierce and care about their health, and they're organizers and they're amazing. And so we've done a bunch of workshops with them on different ways and different cleaning products and chemicals in cleaning products. All of those presentations are always in Spanish because the majority of them only speak Spanish. And it's really exciting to see how once they learn about the different chemicals and their disinfectants and things like that, some of them have changed, some of them have went to their employers and asked for safer products. So that's so exciting to see that our organization is helping in many, many different ways. And then we also, I wanted to show an example of going outside of California. We were asked to go to the Toxic Donut in Chicago, which is a predominantly Black neighborhood that is surrounded by toxic chemicals and is extremely polluted and disenfranchised. And so we got the opportunity to talk about environmental health and justice advocacy training linked to breast cancer risk, as they have a very high cancer risk in this neighborhood. So BCPP is really big on making sure the community is at the forefront, and that is what I do as a senior organizing manager. And we think it's very important to use that community wisdom, especially, like I said, those closest to the solution, those closest to the problem know their solutions. And so those are some examples of what BCPP is doing around community engagement. We're really excited to continue. We're hoping to get this phase 2 so we can work with our farm worker communities, and in many other ways, and also with our EJ and environmental justice communities as well. And so if you want more information, bcpp.org has so many things. We have DIY ways to make different products for yourself. We have so much information. We have the campaign for safer cosmetics, ways to look up how your consumer products have different chemicals and what to look for and what to buy, et cetera, et cetera. So please check out our website. And also you can email me or reach out to me if you have any other questions. And so now I'm going to turn it over to Lianna, who is going to introduce herself, our next panelist and our next presenter.
Thank you, Nyisha. Let me share my screen. Okay. So Zero Breast Cancer was an independent nonprofit for 28 years, before becoming part of Collaborative for Health and the Environment, or CHE, in 2024. And I've been with Zero Breast Cancer for almost 8 years. We have breast cancer prevention and survivorship health and wellness programs, including resources starting with kids as young as age 5, through survivors, and a health and wellness coaching program. So throughout our history, we've centered community perspectives in our program development. And to illustrate the process we started adopting in 2016, I'm going to talk through our generations resources, or in Spanish, generaciones, just as an example of what we've created. So the funding of our resource development often starts with grants to researchers that include a community advisory board, or advocates on the research team, and funds for dissemination of findings. So we often facilitate the community advisory boards. They're usually about 8 to 12 participants in the study. And then we also lead dissemination efforts. So for example, a Child Health and Development Studies, or CHDS, project from 2016 to 2020, we facilitated the Breast Cancer in the Environment Across Generations advisory group. And the research was funded by California Breast Cancer Research Program, as Nyisha mentioned as well. They are really key partners in promoting community involvement in research. So very much appreciated. And the research studied the multi-generational impact of endocrine disrupting chemicals, or EDCs. So CHDS, just a background on the study itself, started enrolling pregnant participants and their partners in the 1960s and collected health data, including blood serums. And their research follows those individuals, their children, and their grandchildren throughout their lives. So the BCEG advisory group consisted of 3 generations of Black, Latina, and white women, so grandmothers, mothers, and granddaughters, who are participants in the larger CHDS study. And they helped guide a lot of, all of what we ended up producing as part of this research. And we really based it in the research findings and using the expertise of the research to get the facts right, but the community input to get the actual dissemination and community messages right. This is a chart that we shared with the BCG advisors to help explain some of the process. And the first 3 boxes are the things that the grant originally proposed that we work on. So for the key problem, EDC exposures and breast cancer, the target audience, women of childbearing age, diverse race and ethnicity, and low incomes. And then for the engaging the target audience, the grant specified a 3rd generation meeting and a discussion or focus group led by ZBC. And then you can see here, developing the messages is done with the target audience feedback, the format and style. We draft materials, pre-test them, tweak them, publish and distribute, and then evaluate. And all of this we did with the BCEG advisors making the decisions and getting input from community members that are in the target audience for to shape the decisions that the BCEG advisors made. So for their guidance before we even got feedback was they shaped the target audience. So they wanted it to be young adults of all genders, including men, because sperm is relevant, as well as gender diverse people. Some diversity in race and ethnicity, which was in the original grant, and low income, which was in the original grant. And the idea was to focus on pre-pregnancy so that the multiple generations could be impacted. They also, we all are on the same page that breast cancer is the primary reason we're doing this, but the advisors also suggested we include other diseases in our communication, since we want people to be as healthy as possible and not everybody cares about breast cancer as the primary thing. And then they suggested originally that we do videos, but we didn't have enough funding to do that at the time. So we decided to do a series of posters and a website, and they suggested the outline of those. So they thought that a multi-generational message would be the most motivating for people, and that each poster should have a source of exposure and one step that can be taken. And then the website explains more of the science behind how it's multi-generational and what the source of exposure is, and then more steps that can be taken. So with this BCG guidance, we sought target audience feedback to select the topic areas, the actual message and the wording that we used, and the graphics and colors and everything about this campaign we got target audience feedback on by interviewing 15 young adults pre-pregnancy 2 times, first about the topic and messages, and then about the potential graphic styles. And we focused on finding young adults from diverse racial ethnic backgrounds and who had lower incomes or education levels. And here's some examples. Oh, and we did a focus group in Berkeley with about 8 people that we got more feedback on some of the graphics and the messages. So here you can see that we had these different styles. This was after the messages were chosen, but got feedback, from more cartoony to like cartoon with photos to more photos. We had one with more of a negative tone that we tried, and then more positive. And we looked at different fonts as well as different orders of presenting the material. And we took this information back to the BCG advisors, what the target audience said, and they ultimately made the decision to go with a photorealistic style that focused on hands from people with diverse races and ethnicities, especially Black and Latino or Latinx or Latina participants, subjects. And they ended up having the protecting yourself protects future generations is what was meaningful from a multi-generational background. And then you can see on here the component for the source of exposure, shampoo, deodorant, cosmetics, etc., can contain harmful chemicals. And then a strategy to reduce exposure, as well as at the bottom, a short link to the website, which has a lot more information. And then after developing these, we did a survey that received 73 responses to give us more information about how people were interpreting our resources. And that gave us some more feedback on how to refine them. So all of this, of course, is done to communicate research findings, as well as to, and it has everything's checked by the researchers, guided by what solid science says about this, these messages. So very much in partnership with CHDS as well. So after developing the Generations campaign, we received additional funding to develop it into Spanish, and that's always a priority for Zero Breast Cancer, to get as many resources as we can in English and Spanish. And what's really important to us is to truly adapt the materials rather than just translate them. We hired a native Spanish-speaking staff person, and she interviewed and surveyed native Spanish speakers about the messages that were used, the graphics or the photos that were used. And it really shaped, making these changes. So it wasn't just one person looking at this and changing the language, but 8 people giving really thorough input on this and the website at this point in time, since that had already been developed. And you can see in this, we changed the photo for the app one to something that they thought would be a little bit clearer. And the app itself is now Yucca instead of Think Dirty, because Think Dirty was not available in Spanish, but Yucca was. So we were still able to keep that goal message, but change that. So some of these photos shifted a little bit based on the Spanish language feedback that we got. And then the target audience and the BCG advisors also shaped our dissemination by suggesting that we share it at health centers, high schools and colleges, train or bus stops, as you can see here. We did Google ads, and we also posted on social media. So that target audience feedback, community feedback was really centered in how we shared this information too. So for next steps, we are taking the advice of the BCG advisors and got funding to do videos with child health and development studies on 2 new research projects. So one looking at the intergenerational transmission of breast cancer risk for Black women, and another looking at the intergenerational transmission of risk through sperm. And then we also have funding on a chemical mixture study with Dr. Kimberly Badal at UCSF. And you can see in our process so far, we've been working on the style and tone. So I've put here a couple of or 4 of the images that we shared with the target audience to find out that number 3 and number 2 were preferable, with number 3 being the most desirable, but people preferring like the more of the happier tone of number 2 and some of the lighter colors in number 2. So we also shared sample videos with them and are getting that feedback as well. So it's all ongoing in the way that we're doing this. And I also wanted to share that community feedback is central in all of our other programs, including but it might look a little bit different. So for the survivorship fact sheets, it's based on a NIH pathways study by the Kaiser Permanente Division of Research. And we got community advisory board feedback in that a little bit less target audience of testing the messages just due to funding, but shaped us having stories in these rather than just facts. And then Healthy Futures, or Futuro Saludables, is a activity book for kids ages 5 to 8. And we really did extensive parent feedback as well as interviewed kids in this age range and had them complete these activities in order to test how things were done, and piloted an after-school program too. So that shaped, both the graphics and the style, but also what the activities were and the wording to make it more fun and engaging for kids. And then Resilient Me Health and Wellness Coaching, we developed the branding of it with target audience feedback. And then we always get pre-program surveys, mid-program surveys, and post-program surveys from participants in order to really refine and shape the program, as well as from the coaches, so that we can improve throughout based on target audience feedback and actual participant feedback. And then our webinars always have a survey that we get at the end of them, which you'll see we've added a survey to this webinar today. So hopefully we can get some of your feedback on how this webinar went. So I just briefly wanted to go over some challenges and learnings, since I think that's something that we can move forward with. So the timeline, obviously this takes like at least a year to do this sort of extensive feedback. Maybe you could rush it and do it in 6 months, but it takes a fair amount of time to incorporate this. And it's obviously not something you would use just to create a social media graphic. It's something that you're doing to create a more evergreen resource that people are going to use over time. Funding can be a bit of a challenge to get funders interested in doing this important science translation work that really takes a little bit longer, but has really thorough community feedback. Also, when you have a community advisory group or advisors, advocates on a study, people, are on board with this pretty easily, but we do have to keep in mind that we want to base it on the target audience, many of whom know a lot less about the topic than the advisors that are on the study, who are community members. So that's something to just keep in mind. It can be challenging to find people to give feedback. We always have offered a financial incentive. We've tried increasing it from $25 to $100. Doesn't always seem to make a big difference how much money's offered. But we did find a user testing platform that has been really useful that includes the audience in it. So they have a pro bono account, and I'd be happy to share more about that if people are interested. And then also it's really important to do Spanish language adaptation beyond translation, which has always been the intention of what we've done moving forward. And then interviews, we found a lot more valuable than surveys, just to really get people's explanations of why they like certain things, rather than just like ranking if they like something or not. So that is wraps up my presentation, and I will pass it to Sama.
Thank you so much, Lianna. Yeah, perfect. Buenos dias. Good morning from Dena'ina Lands, Alaska, Anchorage, Alaska. My name is Samarys Seguinot Medina. Can you still see my screen? Yeah. My name is Samarys Seguinot Medina. I work at Alaska Community Action on Toxics as the Environmental Health Director. People call me Sama, and also by my Siberian given Yupik name, Amyugalik. Thank you so much for the previous presentations. I learned so much. And thank you for being here in Shea, Alaska. Something that I want to share with you is a resource that we created, and we are so excited to have it available for everybody. It's an environmental health toolkit for breast cancer prevention and protecting the health of people living with breast cancer. We title it Protecting Our Mamaks, which is one of the words in Alaska Native languages that we use. And we'll talk a little bit more about the integration and revitalization of Alaska Native languages. First, I want to make an acknowledgement. I kind of already started doing that, but I want to do a more official acknowledgement. I acknowledge that our offices are located on the ancestral and unceded traditional territories of the Dena'ina peoples. The indigenous people of this land never surrender lands or resources to Russia or the United States. And then I want to share briefly ACAT's mission. We believe that everyone has the right to clean air, clean water, and toxic-free food. And that's the main force and mission, basically, that drives our work. We also like to honor, and this is kind of an introduction to our work, Annie Aloha. Annie Aloha was a community health aide, respected elder, midwife, and advocate for health and justice from native village of Savunga, from Sivukak Island, Alaska, also known as St. Lawrence Island. Annie was a former health aide, like I said. And you see a picture of her, and the background you see waste site, a military waste site from the United States, left behind in what used to be the Northeast Cape village. The military came, to make a long story short, with everything they needed for more than 20 years during the Cold War era. When the Cold War era ended with Russia, they left everything behind except their backpack and rifle, contaminated the land of Northeast Cape. And then what Annie started seeing was illnesses that she could not explain, that they didn't see before in their communities. She realized that that was cancer. She started looking for help, calling agencies after agencies, asking for help. After 20 years, she went around full circle with no answers. She met our executive director, Pamela Miller, in a conference, and she became our biggest inspiration. Thanks to the work that Annie Aloha did, we are bringing attention to the cancer crisis that the people of Sibukat and other people in Alaska are experiencing, thanks to a community health aide that gave all her life to bring environmental justice to our community. So we honor her. And this is one of the reasons why we do this work and prepare these resources. Another reason, besides military pollution that I just mentioned from the Department of Defense in the United States, there's other environmental health concerns and contaminants in Alaska in the Arctic. And we always like to share these two images. The one on the left is a map of Alaska. And I don't know how clear you can see in your screen, a little legend on the upper left corner of that map showing all the toxic waste sites in Alaska, from formerly used defense sites, Superfund sites, radioactive waste sites, chemical weapons dumps. So it's a huge injustice. If you look at the locations of many of the Alaska Native communities in Alaska, it will coincide with many of those dots and points. So many cases of environmental injustice and exposure to harmful contaminants and substances that are toxic. Another exposure is chemicals that travel from other parts of the world and locate in Alaska. We call that the grasshopper effect. Many of these chemicals come from ocean and air currents, and then they are volatile. They drop when they get to the north, to the Arctic, to the North Poles and the South Pole, and they are accumulated in the land, the water, the snow, the permafrost, the ice. And now with rapid climate change, we're seeing the release of those contaminants even faster than we've seen in the past. This is just as an introduction why this is so important and relevant here in Alaska. So the toolkit, we are super excited. This was a collaborative effort. Before I go into the toolkit, I wanna acknowledge the people that work to make this happen. First, the beautiful art cover of the toolkit was done by a former ACAD intern, Kelly Dunn. So we really appreciate her beautiful work to make this beautiful representation of Alaska Native mothers and women. Protecting Our Mamas also was done by the also former Sarah Petras, former ACAD staff. And all the contributors were many interns that work and review as part of the process of making the toolkit. We also have a peer review list. Erica Padicki, community health aide and community health researcher, former also mayor of Gamble, native village of Gamble, review the toolkit. We also have our executive director review the toolkit, Ted Shetler, and I think I saw your name, so thank you for joining us today in this call and webinar. Thank you for your review and all your support. And myself and our Environmental Health and Justice Program Director, Wai Wahi. It was took us some time, but we were able to make it a reality. Another important thing that I wanted to acknowledge and share with you is a gender inclusivity statement. It's important to bring up and address the intersections of environmental justice with other social justices and causes and injustices. ECA recognizes that people of different genders identities can be at risk of breast cancer. Furthermore, transgender and queer, non-binary, and two-spirit people may face discrimination and a lack of access to gender-affirming breast cancer information, screening, and care. ACAD advocates for an approach to breast cancer research, awareness, and resources access that is gender inclusive. Breast cancer research is needed that includes experiences and investigates the risk factors of people of diverse gender identities and for those who may or may not have undergone gender-affirming care. Making breast cancer healthcare inclusive of and accessible to people of marginalized gender identities is incredibly important. Throughout this toolkit, we have attempted to be mindful of our gender language. In this toolkit, we use the term peoples, quote unquote, when addressing broader statements about breast cancer, and we use the gender term woman, quote unquote, in statements based on information gathered from studies performed with women participants, and most do not specify other gender identities. So we welcome any suggestion. We got great feedback from the time that we launched the toolkit and the other resources that come with it. So we always feel very grateful to have feedback from you on things that we can better from it. Why make the toolkit here in Alaska? We see a high prevalence and also high mortality of breast cancer in Alaska Native women here in Alaska. Mortality rates for Alaska Native women are higher than white women compare in statistics. We create this toolkit specially for Alaska community health aides and practitioners to train them on how to identify chemicals or what are the chemicals found in the North and the Arctic regions that are linked to breast cancer. Also to help them determine if the patient may have had an environmental exposure to toxic contaminants. Also include information to share with patients on how to reduce their exposures to chemicals of concern. It's a huge network. The Alaska Community Health Aid Program, the acronym is CHAP. It's a network of approximately 550 community health aides and practitioners in over 170 rural Alaska villages. And that's the logo of the CHAP program on the right. Also, the CHAP work is assessing and providing emergent and acute and chronic care to residents of the respective communities in many Alaska Native remote regions. Alaska CHAP are in the front line of healthcare in their communities. That's why we want to elevate their work and their commitment, and also honor, like I said in the beginning, former community health aide like Annie Aloha and others. We want to prevent exposure to toxics. That's the main thing that we want to do with our mission. Alaskans may be exposed to chemicals, like I said, that come from hundreds of toxic waste sites scattered throughout Alaska, like you saw in the map. Industrial pollutants from global sources carried north by air and ocean currents, like I mentioned. Also, other local sources like air pollution, contaminated foods, pesticides, work environments, personal care, and consumer products. ECA works to prevent harm and eliminate unnecessary exposure. We work with communities. For example, we've been working with the communities of Sibukak, native village of Gamble and Sabunga in community-based participatory research for the last 20 plus years, and also have an honor of having a community advisory board that guides our work. So raising awareness is one of the ways that we are really sure can reduce and prevent exposure. And we, as one of our core principles, people have the right to know. So this is a right to know issue as well. These are the objectives of the toolkit. I'm not going to read all that, but just to show people. And not only is this is useful for community health aides, but for other people that want to learn and use this resource. We hope that the CHAP and other tribal healthcare providers can help Alaska Native women reduce their exposure to harmful chemicals that cause cancer and hormone disruption. Also, we hope to discuss risk reduction with their patients as an important part of breast cancer prevention and care for those living with cancer. Just to see kind of how the toolkit was organized, the content, we divided the toolkit in 3 parts. Model 1, Model 2, and then the last part is an assessment for and additional resources. In Model 1, you're going to see what is breast cancer, a definition, and what causes breast cancer, what are the environmental contaminants. It goes in more detail linked to breast cancer. Then we talk about breast cancer and environmental justice. We mentioned prevention starts with education, so a note about education on breast cancer. And pink washing and breast cancer prevention, which is a very important one. I'm going to share a little bit more about pink washing. The module 2, we decided to make it easier for the reader and the community health aide to share this information with patients, to create the information in fact sheets of 1 or 2 sheets. And we have a set of 9 fact sheets talking about air pollution, flame retardants, occupational exposure, PFAS, in household consumer products, POPs, persistent organic pollutants, personal care products, cosmetics, pesticides, traditional foods, and diet and nutrition. And this is just to show you kind of how it looks. This is the module 1, the beginning, showing a definition of breast cancer, some statistics and history of breast cancer in Alaska. And then we have some quotes, some relevant information that we wanted to highlight. For example, on the upper right corner, the quote says breast cancer in women under the age of 40 is 58% higher in Alaska Native women compared to non-Hispanic white women in the same region. So full of important information on why this is so relevant and how to share this information. Also, we share images of the work we've done throughout communities in our CVPR work. So also it's a visual representation of the work. The way the fact sheets are organized is that they talk about the pollutant, where you can find it and how can you be exposed, the health effects, and then how to take action and how to lower, reduce, or eliminate exposure. This is the pink washing fact sheet as part of that module 1. And I just want to share the definition. A lot of people hear the word pink washing and don't know what it is. Pink washer or pink washing, a company or organization, this is a definition, that claims that to care about breast cancer by promoting a pink ribbon product, but at the same time produces, manufactures, and or sells products that are linked to the disease. So that is pink washing. I invite you to share this knowledge. Um, we know that our friends from Breast Cancer Action, they did amazing work in this program. I know that I think BCPP is continuing that amazing and important work, educating people and really bringing up science and who is really rooting for real solutions to breast cancer. And this is the last part, the assessment environmental exposure form that we provide so community health aides can assess, or family members can kind of assess and have a record of potential exposures. These are some of the additional resources at the end of the toolkit. We have many websites and partners, like the colleagues that we have in this call, sharing their website and information on the work they do and their resources. So we invite you to check that out. As part of this educational resource, we also created a poster that is hanging in clinics, in many health practitioners' offices and health professional offices. And we created a QR code so people can scan it and go directly to the toolkit and other resources that we have in ACAT's website. We have fact cards that we put on tables that are more summarized aspect of the fact sheets. And they basically show what is the chemical, what is the concern about that chemical or chemicals, and they a way to reduce or eliminate exposure. These are beautiful as well, and we are super excited and happy to introduce our Yungtung fact cards. Yungtung is Yupik, another word for Yupik, and it was one of the traditional Alaska Native languages. And we did a partnership with Alaska Research Interest Group here in Anchorage, and they have a committee of translators, Alaska Native translators, and we worked together for a little bit more than a year to get this translated into Yungtung, which is the Alaska Native languages that's mostly spoken in Alaska. Now we're in the process of doing the part 2 and starting the conversations to translate it into Inupiaq, which is the next language. So we are very proud of this. We're gonna be uploading these to our website so you can find them and share them. And there's a translation for each 9 fact sheets or fact cards. We also invite you to join us in the Indigenous Women's Network and Facebook. We share information, we connect with other women that are interested in environmental justice and health work. And then, like Sarah Banapur said in the beginning, we're so grateful for the funding and support and encouragement from Alaska Run for Women, Cedar Tree Foundation, and Groundswell Fund. Thank you so much for your time. You can find us in social media, and you can definitely find the toolkit in the publication section in our website, which is www.akaction.org. Thank you.
Thank you, Selma. And thank you to all our speakers. That was really great to hear about all the ways you're meaningfully engaging with our communities. And I think now we're ready to jump into the audience Q&A. So I see there's a few already in there. And I think the first one here is for Nyisha. I think it was centering. Yeah. So they said, is it possible to share a specific list of what you adapted based on the first regional training feedback?
I don't have a specific list, but I can just tell you what we received in the feedback. So in LA, we made the regional meeting. We anticipated the regional meeting would be 3 hours. We always feed our folks if it's over an hour at least. I don't believe in bringing people into a meeting for 3 hours and not feeding them. But we focused a lot on the group concept mapping results, which was very overwhelming for the community. We hired a consultant to do all that data analysis. So when we brought the results are great. And if anybody wanted to know more about them, we have them still. But for community members who aren't scientists, who may not understand, control versus this group. It was very confusing. So we took that out. And instead, what we did was focus on the top 10 most ranked, highest ranked, and the ranking was up to a 5, but we took the highest ranked in those regions and just discussed those interventions versus going into the group concept mapping and all the detail about that. It was very confusing for folks. We also shortened it, and we also learned that when we invite people to co-host, so community-based organizations that already have very strong ties in the communities that we were looking to host regional meetings, we asked them to be co-hosts, and we actually got more attendees. And so we figured that out in the LA regional meeting, that, having a co-host or having people who also are in EJ or doing that work on the ground attracts people who know that organization, who understand the work that they're doing already. And then we also changed like location. So in LA, we did it at the California Endowment Center, which is very well known in LA, but it's not always accessible to get to. So I made sure that I looked for places that might have had public transportation access, parking, because parking is always a thing, and free parking at that. That was difficult in the Bay Area, but we figured it out. And we also offered transportation stipends. And so we were very big on making sure we paid people for their labor. So we did pay people for the group concept mapping survey because it was very long. We gave gift cards out, and we also offered physical cash to folks who were traveling far for gas money. We also offered, if people needed hotel rooms for some of the trainings, we offered funding for that too. So just listening and learning to the folks in the room about what would be the best way to get more people in the room and more people who deserved and needed to be in that room. And we also made sure, finally, we bought our own interpretation equipment because we were having to rent it. And so we finally were like, let's just purchase our own. And so we have interpretation equipment and that allows for simultaneous interpretation at all of our meetings. Most of our meetings had a Spanish interpreter, but if we needed another one, because in California, the second most spoken language is Spanish, but the third is actually Mandarin. And so we have some of our fact sheets in Mandarin and Tagalog for Filipino folks. So just, listening is key. And so we learned a lot in LA. And I think LA was a great starting place, as LA is very diverse, one of the most diverse places in California. So that feedback was very helpful. So yeah, I hope that answered.
Thank you, Nyisha. And then I see this next question, which could be for all of our speakers. How are you addressing the problem of recurrence of breast cancer after changing to a healthier lifestyle and self-education of hazards?
Well, I can share for zero breast cancer has a lot of risk reduction, recurrence reduction stuff with survivors of breast cancer. And we do webinars on those topics with our Kaiser Permanente Division of Research Pathways study findings. We also offer a health and wellness coaching program for participants or for clients after active breast cancer treatment to help people implement lifestyle as well as limiting exposure to endocrine disrupting chemicals in their everyday lives. So that's a one-on-one program for 12 weeks that we offer for recurrence risk reduction. So in the development of our resources, that's really key. We do a lot of primary prevention too for pre-breast cancer, but also the primary prevention for recurrence prevention too.
Yeah, we have some resources on our website about primary prevention for reoccurrence. We also, I just wanted to put a plug into some of the work we're doing. So we have a campaign to remove DEHP out of IV tubing, which is a plasticizer that is super harmful and linked to breast cancer risk. But why I'm bringing that up is because breast cancer survivors have been supporting this bill because it impacts the medicine that they're getting if DHP is in the IV bags and tubing. So that is another way we get folks who are dealing with breast cancer involved, is, these bills and these webinars around toxic chemical exposures.
Mhm. Thank you. Like Nyisha, in Alaska here, we are working on legislation as well, for many of these chemicals. That's a great question. Thank you for asking that. Make me think about other things, and it's great to hear all the resources that you bring in here also as well. Um, Legislation to ban PFAS, legislation to ban freight retardants, which we have passed. Also legislation to ban styrofoam, which we have right now. We're working on the legislature. We couldn't pass this bill this time, this session, but hopefully in January we'll come back with a styrofoam bill to eliminate styrofoam here in Anchorage and Alaska, from restaurants and all the styrofoam that is used in the food industry and all that. Yeah, so legislation and advocacy in those terms is part in education, right? There's so much information coming out. Now we have microplastics and plastics who also there's strong associations to breast cancer and other cancers because of the additives that are added to plastic, that are products that come from oil and gas production. I saw some questions about that also. So yeah, thank you.
Yeah, maybe we can segue into that question. Someone asked about how we educate people on the harms from oil and petrochemicals, the processes, drilling, fracking, use, transportation.
So while BCPP, we don't necessarily work in that industry, we work in coalition with that industry. So we work with all kinds of organizations that are fighting against fracking and oil drilling in California. That is one of the risk factors, is like your lived in social built environment. So if you live close to an airport or highway, you are more likely to be exposed. So we talk about that. So we have a lot of resources. We don't like work directly in the oil and gas industry, but we know the harms, and we know that things like benzene have a direct link to breast cancer risk. So we're big on working in coalition with environmental justice organizations.
And just to add, here in Alaska, we have oil and gas, extraction and production. So we partner with communities, not only providing information, scientific, reliable information, also doing community-based participatory research so people can provide their own knowledge of the situation and the issue. And also here in Alaska, in terms of oil and gas, pink washing, it's not talked enough. I think we need to talk more about pinkwashing and how the industry is presenting themselves as saviors, and they're not. They are the root of the cause of the problem, in many situations for breast cancer. So I'll just leave it at that.
Yes. And like Sama said, breast cancer action is no longer existing. And so we are taking over the Think Before You Pink campaign at BCPP, and it will be me leading that charge. So stay tuned. I'm still doing research and getting all the collateral and all the things. And we used to work very close with BCA. So this is very bittersweet because they did amazing work, but we're thankful that we got that campaign. So stay tuned.
When
Love it.
BCA had a lot of stuff on the oil industry, I think.
Oh,
Do
yeah.
you did you get that collateral, or did that go to the other organization that took BCA stuff?
No, I believe we're getting everything.
Okay.
So it's just me. So, give me some time, but hopefully we'll be releasing something in the Breast Cancer Awareness Month, October. More, but yeah, more to come on that. But yes, we will be taking that over.
Really looking forward to that. That's such an important aspect of this. I think we'll go like a minute or two over just because I want to answer the last couple questions. Someone asked if we have advice on doing work at scale and ensuring we do no harm in the process of trying to scale it.
Well, first I will say that we will do harm. And I don't mean that in like we just have to be okay with, like, we might make a mistake and it's not intentional. We just have to remember to take accountability for that. So I never like when we're like, oh, let's do no harm. There's no such thing. There will always be some type of harm, maybe not very, very malicious or very, very harmful, but you might offend somebody, you might do something. But it's important for us at BCPP, it's important that we start off with community wisdom always. We cannot do this work without the folks who are most impacted at the forefront of this conversation. Otherwise, we are just bringing our expertise to them. And that's great, but that's not community-based work. So I think it's important to just really listen, because what we think is an important topic might not be what that community wants to work on, but it is still related to the work and the mission of our work. So that's what I'll say.
Yeah, I'll just say, in terms of scaling the outreach of the materials we've disseminated, we don't stop asking for feedback or being open to changing things. And so it's not like something's done and then that's it for eternity. It's a continual process of learning from what you get in response and making changes based on that.
I echo what my colleague said. Nothing is done without the consent and involvement of the community and the leadership and the people of the communities. They are the experts. They know their problem really well. They know what they need. And we are here to serve them, find solutions, and empower them. So, yeah.
Great, thank you. And then just as our last question, I love this question. Someone asked, is there any research opportunity available for high school students? I think someone mentioned Kaiser Permanente's research.
Yeah, so I don't specifically know of any research, but I do know that there are projects funded by California Breast Cancer Research Program that include high school students and youth. And Zero Breast Cancer years ago had a youth advisory board with a study that we were doing. So those opportunities do exist. I don't know of any currently that are going on. Recently, we did engage teens who were interns in our dissemination efforts and are refining a program. So sometimes we've accepted interns in terms of communicating and doing science translation work, but I don't have a current opportunity for that right now, but certainly high schools are involved in that.
Yeah, we have interns in our science department, but they are often in college. I can't think of anything in BCPP right now, but I will ask, because we always need help and love support. But I will say that when you get into college, you should definitely look up. We have also taken over Protect Our Breasts, which is an amazing organization that works in college campuses. So they have merged with us and they are at BCPP now. And so when you get into college, I would recommend looking up Protect Our Breast. We are restructuring and getting ready to start launching that for the next school year. So yeah. But I'll try to think of some I don't know if I know any opportunities right now, but definitely check out our website when they have opportunities for internships, because they're always good and helpful and a great way to get involved.
Che's actually looking for some interns right now for science communication, which I believe Sarah had a Che internship before she started with ACAT. And some of that is working with me on blogs translating or doing science translation for the chemical mixture study. So look at Che's website for college students that are looking for paid internship opportunities.
We've been lucky with interns at ACAT. So yes, internships. And now with the support of the Alaska Run for Women, we've been visiting high schools in Anchorage and other parts of Alaska, because we see the statistics show that younger and younger in ages are getting diagnosed with breast cancer. So we understood, and the Alaska Run for Women understood as well, that it was necessary to start talking about these issues and providing this information at a younger age. So yes.
Super important. Thank you. I think that's all the questions we have time for today. So thank you so much for sending them in. And of course, thank you to our speakers for joining us today. We're really grateful you could be here with us. And we'll have a recording of this webinar available on our website probably later today, and it'll also be sent to your emails as well. Please keep an eye out for more CHE Alaska webinars on the CHE and ACAT websites, and we will see you next time.
Thank you
Thank
so
you.
much.
Thank you so
Bye.
much.